Hi everyone, today I shall discuss an important bone where our organ of hearing is located. You see, the name of the bone is known as the temporal bone. The why it is called temporal bones, because all of you know that the graying of the hair starts from the temple. So this is the temporal bone. Now this temporal bone has got 5 parts. This one is the squamous part of the temporal bone, that means scale-like part. This one is the pitrus part of the temporal bone, which is densest among the all cranial bone. And within this pitrus part of the temporal bone, our middle ear, internal ear, by which the sound is perceived, that is done within this small area. So how important the bone is. Next, you will see there is the tympanic part of the bone. This is the tympanic part of the bone. The fourth part is known as the mastoid part of the bone. This is the mastoid part of the bone. And the fifth part is known as spine-like styloid process, which is broken here. So I shall show you in this skull. So this is the two styloid process which gives attachment to the muscle that suspend our that is the esophagus and pharynx. All of you know the pharynx, all of you suffer from the pharyngitis, so it is very common to all of you. So this styloid process is suspend this structure. So these are the 5 parts of the temporal bone. Now the squamous part I shall discuss first. The upper border of the squamous part, you will see there is a beveling. What do you mean by the beveling? Beveling means some portion of the thing is cut away. That is the beveling. So this portion, this is the beveled part. You see, this portion is the beveled part. So here you will see there is beveling here. So you see this beveling occurs at the expense of the internal surface, and that you will see this is a bone which is known as the parietal bone, and in this parietal bone you will see there is the beveling on the external surface, so that this temporal bone fits with the parietal bone in such a manner. Next, you will see the external surface is very smooth. This external surface, it gives attachment to a very strong muscle. You clench your teeth, you will see a muscle becomes prominent. All of you clench your teeth, and this is known as the temporalis muscle. So the temporalis muscle, you see, I make this attachment of the temporalis muscle. This temporalis muscle, this is the strong muscle, one of the muscles of mastication. That means that mastication occurred in a joint that is known as the temporomandibular joint. So we always chew, we always bite some mutton and all this thing, the bones, and that will give our pleasure. But this thing done by this strong muscle, that is known as the temporalis muscle. Next, you will see this is the squamous part. Inner surface of the squamous part, you will see there are some area of elevation and depression. This portion gives in relation with the temporal lobe of the brain, where this auditory sound is interpreted in this portion of the brain. We can differentiate how there is the sound of the bomb and what is the musical sound. So next thing, that is the pitrus part of the temporal bone. This pitrus part of the temporal bone, it forms a fossa which is known as the middle cranial fossa, this fossa. So you see there are the dural venous sinuses and part of the posterior cranial fossa. This is the pitrus part of the temporal bone. Now the important thing present here, that is the middle ear cavity. That means our sound is magnified in the middle ear cavity. In the squamous part, you will see there is an opening. This is known as external auditory meatus. This is the external auditory meatus, and if you pull this meatus, you will see some portion, not the bony part but a cartilaginous part moves. That is the cartilaginous part of the external auditory meatus. So you will get here above the external auditory meatus there is a small triangular area, very small, and this small triangular area is known as suprameatal triangle. The ENT surgeon, they drill this from this region and take out pus from the mastoid antrum. Next is, you will see, next thing, this pitrus portion has got three surfaces. What are these? Superior surface, which forms the roof of the middle ear cavity, and there is some elevation here where our organ of balance is situated, that small comma-like area. Now this is known as the arcuate eminence. Next is the, you will see, the posterior surface of the pitrus part of the temporal bone. Here one can see this region. This is the internal auditory meatus. This is the external auditory meatus where sound goes, that is modulated and comes out from here as a nerve. What is the name of the nerve? The vestibulocochlear nerve. The vestibular nerve maintains the balance and the cochlear nerve helps in the audition. Next thing, the anterior part of this pitrus part of the temporal bone. Here there are two openings, small opening, and through this opening one can actually put the air within the middle ear, and that another part of the opening is actually related to our side of the mouth cavity, that is the nasopharynx, and this is known as the auditory tube that maintains the balance. All of you know, when you will come from the aeroplane, it takes into the ground, at that time there is change of the pressure, and in the change of the pressure you will see your tympanic membrane is moving and there is intense pain in the ear. Next, you will see that this is the region, a opening. This is known as the carotid canal. Now this carotid canal, it begins from the inferior surface and then it comes out. So you will see the pitrus part of the temporal bone. Now the inferior surface of the pitrus part of the temporal bone. You will see there is a depression here, and this depression, it will accommodate the sigmoid sinus, which I shall show one, that is the sigmoid sinus. So this is very important to know, because the ENT surgeon, they are in trouble. If the sigmoid sinus will break, then there will be very problem. Next is that I shall say about the mastoid part of the temporal bone. You see, this is the mastoid part of the temporal bone, and this mastoid part, mastoid process, one can feel the mastoid process behind the ear. This is the auricle. Behind that you can feel this bone, and in this bone an important muscle is attached, that is, one is known as the posterior belly of digastric. It is attached here and comes to the region of the neck. So this is the known as the posterior belly of the digastric muscle. Next thing, you will see this tympanic part of the temporal bone. Now this tympanic part of the temporal bone is very thin plate, and it forms the anterior-inferior boundary of our external auditory meatus and also the middle ear cavity. So this is the temporal bone, and this is the zygomatic process This is the zygomatic process. This is formed by the zygomatic process of the temporal bone and the zygomatic temporal process of the zygomatic bone. So this is a very important. Another strong muscle is attached here, that is known as the masseter. So again, this is the muscles of mastication. You chew, you can feel the masseter. It is such a strong muscle. So how will you hold the bone in anatomical position? You should place the bevel superior border superiorly. The internal surface will be marked by elevation and depression, as well as by the pitrus part of the temporal bone. The anterior part is marked by the zygomatic process, and this mastered process is directed below. So this is how in our body the temporal bone is situated. Thank you everyone.